Hi, everyone. This is Lynn Crawford with Hope Dementia Support, and we're here this evening with our friends from the Area Agency on Aging and Disabilities to talk about Medicare open enrollment. These are ladies that know everything there is to know about Medicare. So, with no further ado, I will introduce Fiona Humphrey and Pam Monahan, and they're going to tell you a little bit about themselves.
Okay, I will start. I guess, Pam, do you want to start?
No,
No,
go right ahead. Go right ahead.
all right. Good evening, everybody. I'm Fiona, and I have been a SHIBA volunteer in Clark County for a little over 20 years now. It was the first thing I did after I retired. I decided to become a SHIBA volunteer and help out. So I've been doing it for a while, and I really do love helping people sort through the very complicated issues of Medicare because it's really not that easy. There seems to be, you'd think we'd have a healthcare system that'd be simple, but guess what? We don't. So it's pretty complicated, and I enjoy helping people very much. I also did work for the Area Agency on Aging for 9 years, and in that role, I was their Medicare, Medicaid specialist, helping the care coordinators and other staff, their case managers, with their clients, most of whom had both Medicare and Medicaid. And I retired from that a couple years ago, and now I'm back to being a volunteer. So that's my story. Pam?
Thank you, Fiona. I'm glad you're here. And we just celebrated 20 years of Fiona, her presence being a driving force in SHIBA. And so I'm very glad she was able to join us tonight. And I may, throughout the presentation, uh, tag her in to share any insights that she may have. Because yeah, she's been counseling people a long time on Medicare, and the experience that she has is very deep. So my name is Pam Monahan, and I am the SHIBA and MIPA Program Coordinator for Area Agency on Aging and Disabilities of Southwest Washington. And in that role, I have the honor and the privilege of coordinating and supporting SHIBA volunteers, who are a magnificent group of people who give of their own time and their skill and their heart to be able to walk people through something that is, like Fiona said, a lot more complex than it needs to be. Uh, and and so I want to just honor and recognize that we have caregivers that are here tonight. And I just want to recognize that you don't have to leave this webinar being an expert on Medicare. Some of you might be, I don't know. And if you are, we'd love to hear from you. But um, this basically, we're going to paint kind of in broad strokes tonight. We're going to go over some basics about Medicare, some things that you can do during open enrollment. But ultimately, my hope is that you recognize that in all that you have on your plate, just know that you have support, know that you have help, know that nobody knows, as Fiona said, all the ins and outs of Medicare. And so if you need some support, you're more than welcome. Please call SHIBA. We're here to help. It is a free service. And we would be happy to pair you with a knowledgeable, certified, skilled, trained volunteer who's giving of their time to make life a little bit easier for you, to help you breathe a little bit easier. Um, and I came to awareness of SHIBA personally as a family caregiver. I was helping a loved one transition who was on Social Security disability, transition from Medicaid and to Medicare. And it was terrifying because, my family member had a specialist for every body part, it felt like, was taking an entire cocktail of so many medications that were hard to keep track of. Um, and dealing with the day-to-day grind of anticipating what came next and trying to meet needs. Didn't leave us a whole lot of time to sit down and study a Medicare and You book or do a lot of online research. We had no idea what we were doing when we were stepping into the realm of Medicare. And the big fear was losing access to physicians, to medications. It seemed like we had this delicate balance of getting everything all as we needed it, and then everything was about to change, and it was scary. And so we didn't know what to do. And so primary care physicians said, well, why don't you call SHIBA? We said, what's a SHIBA? And so that was kind of my introduction. I was able to sit down side by side with one of our SHIBA advisors. And then fast forward a number of years, and I came to the Area Agency on Aging and got to thank her at a potluck when I first started in this position. And so now I get to support her and her colleagues, these wonderful volunteers in the work that they do. But I found SHIBA to be welcoming, knowledgeable, and the SHIBA advisor that we met with saved us quite a bit of money that we really needed for paying bills for through the Medicare Savings Program and another program called Extra Help that we had never even heard of, and that we'll talk about a little bit tonight. But I just want to honor all of you for the heart that you put into your day-to-day caregiving and care partnering with people. And I'd like to do something a little bit unusual for a webinar, but I'd like to give you, I can't take you on a trip. I can't, bring you to a tropical island. But one thing that you may not have had the opportunity to do today is breathe. And so I'm just gonna if you'll indulge me just for a moment, just want to take a few deep breaths together, if that's okay. It sounds a little silly, but you deserve just a little smidgen of a moment of self-care, and then we'll start on Medicare, if that's okay. All right, so we'll start. Okay. Okay, thank you. Because it really is all about wellness, and Medicare is just a way to access care. So, all right. Without further ado, I am going to share my screen, and you should see some slides momentarily. And let me know if it works. How are we doing? Nope.
Yep, we
Yep.
can see it just fine.
Okay, perfect.
So while I am still unmuted, I would remind everyone to, if they have questions, to put them either in the Q&A and the chat, and we'll be sure that they're answered before the evening is over.
Okay. All right. So you're seeing Medicare slides in front of you? Is that correct? Okay, perfect.
Yes.
All right. So our emphasis tonight is going to be a bit on Medicare open enrollment, which is coming up. And it runs from October 15th through December 7th. So as you start to hear ads, starting October 1st, when Medicare Advantage companies can start advertising, please don't panic. Just know that you have time to really educate yourself and to learn about what the different plans offer, and to really hone in on something that hopefully will meet your needs. So you have a period of time if you are working with someone to switch Medicare plans, or if it's someone's first time choosing Medicare plan, but just know that you have some time. Okay, and we'll talk a bit about who we are and what we do. I know we touched on that. What you can do during Medicare open enrollment.
Sorry, did you share your screen?
Yep, is it not showing?
Yeah, I've got a message that says they don't see any slides.
Oh goodness. Okay, well we will.
I see the slides.
Okay.
So do I. Yeah.
Let's see. Let's try that again. Any luck?
Oh, somebody just said they just popped in.
The slides did? Okay, perfect. All right, thank you. Okay. So
Sorry.
are we all set?
Yep.
Okay, good. Thank you. Um, so we'll talk a bit about choosing and changing Medicare plans, ways you can get help paying for Medicare, and then at the end we'll have time for questions because I know that our group gathered here has probably some pretty specific questions that you'd like to ask. So if you'd like to put questions in the chat, if we don't cover them during the presentation, then we'll have an open forum where we can talk through some of your questions in more detail. Okay, and SHIBA just celebrated a birthday. SHIBA turned 45, and SHIBA started in 1976, and it was a volunteer-based grassroots movement that they didn't know would become what it is today. It was called the Health Insurance Referral Services, and it was a pilot program out of Mount Vernon. So people met neighbor helping neighbor to talk about health insurance, Medicare, and Medicaid. And then from there, 1978, the Office of the Insurance Commissioner, or OIC, helped the group become SHIBA, which then stood for Senior Health Insurance Benefits Advisors. And it is under the umbrella of consumer protection under the Office of the Insurance Commissioner. So all of our volunteers with SHIBA that counsel clients go through a pretty intense training. And then they take a certification exam and mentor with an experienced SHIBA advisor before they ever counsel somebody one-on-one or offer a presentation. So the people that are part of SHIBA really make a big commitment to study and to stay abreast of the changes in Medicare so that they can share with their neighbors. In 1979, the state's insurance commissioner endorsed SHIBA. And later on in 1990, there was a movement by the federal government to create a model called state health insurance programs, known as SHIPs. So if you travel to another state, you may hear the program referred to as SHIP, but we kept our name SHIBA. And then there are SHIPs available in all 50 states, Puerto Rico, Guam, District of Columbia, and the U.S. Virgin Islands. So it's definitely grown from a handful of thoughtful folks to help people, millions of people nationwide every year. And our goal is to give you the latest Medicare and health coverage information, to inform you, to share with people what their options are, and to help compare their plans. And then, like I benefited from when I was a family caregiver, we want people to know about the programs that are available to help save them money. And I think this is my favorite thing about SHIBA is that we're unbiased. We're not out to sell people anything. It is a free service. It is for the good of consumers. And all of our SHIBA volunteers make a very firm commitment to remain unbiased. So even though, like anyone who studies anything, different people have different strong opinions about this plan or that sort of thing. At the end of the day, every single SHIBA volunteer is committed to helping people understand what their choices are, what their options are, and to be able to get the care and the coverage that works best for them. So it's not about, inflicting, what we think someone should do. It's about, well, what do you want? What works for you? What will help you obtain your meds? What will help you see your doctors? What will help you save money? What works with you? So that's kind of a relief to know that there's no profit motive for SHIBA volunteers, that they're strictly there to support a person so that they can make an educated decision about their health care. One of our principles that SHIBA is passionate about is empowering people to make the best possible decisions, the most informed decisions about their health care. And so we want to be sure that people feel confident, really pursuing what they need with healthcare. And for this group, as family caregivers, you know that sometimes you need to be a dog on a bone. You need to keep going forward and keep pushing and pursuing and poking and getting answers. And if you don't get an answer, you keep being the squeaky wheel and pushing things forward to get what you need. And so we encourage that same kind of relentless approach to advocacy for you and for the people that you care for when it comes to Medicare decisions as well. So we always encourage people to, keep a notebook, copies of paperwork, document any conversations that you have over the phone. Let's say if you're talking to an insurance plan and they tell you that a certain thing is covered, please write it down, at the date, the time. And we really want to just encourage people to take the reins and advocate well for what they need. Um, and also we do a lot of education with consumers on Medicare fraud and how people can protect themselves. And we can kind of touch on that a little bit later too. Fiona, anything you wanted to add so far?
Well, let's see. No, not really. Well, I would add that it's very good if you, particularly if you're on original Medicare and not in a Medicare Advantage plan, you do get statements from Medicare, notice of summary. It's always good to review those carefully to make sure that you haven't been charged for anything, or that anyone you know that you're working with hasn't been charged for anything, because Medicare fraud is a real problem in this country, and a lot of it is being overcharged or charged for things that you did not get. And the only way we can really catch that is to rely on people to be watching their summaries. Okay, so I would add that. Okay.
Yep. Yeah, thank you. Yeah, good point. One of the other outreaches of the SHIBA program in Washington State and beyond is it's called SMP, or the Senior Medicare Patrol. And those are a group of also specially trained volunteers and staff at the Office of the Insurance Commissioner that will help people who feel that perhaps they have been victims of scammers, or they have, let's say, gotten a call that was asking for inappropriate information, or someone pressing them for their Medicare number. Medicare itself will never call a person and demand that you give them your Medicare number over the phone because they already have it. So, but a lot of times people are caught off guard by certain scams, and especially, like Fiona said, certain billing scams. So, even though I know that there's a lot of paperwork that comes at you every day, and I know for me, when I was a caregiver, it was easy for me to I couldn't absorb it, and so I would set down that notice from Medicare, and I didn't want to deal with it, and I would stick my coffee cup on it, and it would absorb the ring for my coffee cup. And we could have been defrauded and not known it for years because I just didn't have the bandwidth mentally and emotionally to pour through my paperwork. But like Fiona said, it can save you a world of hurt just to be able to compare what you see in that statement to the care that was actually received. And then if you have any questions, you can always call SHIBA or call Medicare. One beautiful gift of SHIBA volunteers is that they are issued what's known as a unique ID. And so if there's an instance where somebody needs an advocate to call Medicare with them, that is something that a SHIBA volunteer can do. So that person isn't waiting on hold forever. But a SHIBA volunteer can have a direct line, especially if they work with complex cases. They have a direct line to call Medicare and either advocate on your behalf or alongside you on the phone when contacting Medicare. But a lot of times people, think, oh, I'll never be defrauded. But boy, some of the scams that are out there these days are very tricky, and very smart, capable people, get caught up in them. It can happen to anyone. And so, checking out your statements is a really good first step. So every year plans change. There'll be coverage changes every year. The costs of different plans will change, and over time, your needs change. A lot of times people choose a Medicare plan and then just kind of go on autopilot. And as long as it's working, they don't think about it much, which is great when things are working well. But sometimes there are benefits that are available to you that you may not even realize if you haven't really stopped to kind of pause and look at the details of your Medicare plan. Or needs change, different medications are prescribed. There may be additional savings. So like with most insurance plans, it's great to periodically check them and make sure that, gauge if it's still something that is really serving your needs today. Fiona, anything you want to add on that?
No, that's good.
Nope.
Mm-hmm.
All right. All right.
Mm-hmm.
Okay. So open enrollment for Medicare. Um, it's the annual period when Medicare beneficiaries can reevaluate your coverage. So if you have original Medicare, a Medicare Advantage plan, or a Medicare Part D prescription drug plan, it's always a good idea to evaluate every year to make sure it's still working for you.
Mm-hmm.
And an open enrollment may be the only chance you have each year to make a change to your MA or Medicare Advantage plan and your prescription drug coverage. So, and we'll talk a little bit about what each of these means. And again, like I said, some of you may have Medicare, some of you may have had Medicare for years and years, and you know Medicare inside and out. So, but I did want to give a bit of an overview for some that may be new to navigating these policies and plans. So we encourage folks to start preparing. On October 1st, the floodgates will open, and everywhere you go, you will be hearing about Medicare Advantage plans. You'll get in your car, you'll hear an ad. You turn on your TV, you'll see an ad. You will open your mailbox, you will see an ad. So everywhere you go, Medicare Advantage plans will be wanting your attention and to let you know what their plans offer. So and again, you don't have to decide in that moment. If you have someone approach you about Medicare, you can take your time and really get informed. We encourage folks to read mail from your current plan because you may get a letter letting you know that something has changed. Whether a cost has gone up, uh, perhaps a cost has gone down, or you may have other changes to your coverage that you'll want to know about. And then also the Medicare and You book is a very handy tool. It answers a lot of basic questions about Medicare itself, what it covers, generally what it doesn't. And so people are starting to get those in their mailboxes. And if you're a Medicare beneficiary, you should be getting one every year in the mail. But if not, you can find them online at medicare.gov, the website.
I just
Yeah, please
wanted
jump
to
in.
add
Mhm.
yeah, something really quick before we move on.
Mhm.
We are talking at this point about the commercial market. So these are Medicare Advantage plans that are on the commercial market that anyone with Medicare can go and buy. And their dates are the October 15th to December 7th for open enrollment. Now, if you are someone who has or dealing with someone in your family or caregiving or whatever, and they have coverage that they got through either a company, retiree coverage, or the state retirement benefits, state, Washington, Oregon, anywhere else, federal employees, their dates are different. Most of them do have an open enrollment period around this time of year, but the dates will vary. So just keep in mind that this October 15th and December 7th end that we're talking about is only for those who are in the commercial market. And the rest of you will have to double check if you do have something going on, what the dates are for your open enrollment.
Yeah.
Okay.
Perfect. Yeah, thank you, Fiona. Perfect. Good distinction. Okay. And for people who do select a plan during open enrollment this time of year, your new coverage would start January 1st. Now let's say if someone changes their mind multiple times, the last plan you pick before December 7th is the one that you get. So if you're indecisive or if you change your mind, just know the last plan you pick at the last minute, that's the one. So, and that's the one that you'll carry with you from January 1st on. Okay, and during this open enrollment season, you can join, switch, or drop Medicare Part D, so the prescription plans, Medicare Advantage, which is also called Part C, or you can switch back to original Medicare. You may not be able to enroll in a Medigap plan, and we'll talk a little bit more about that. But as we said, changes take effect January 1st. Okay, and it can be an alphabet soup talking about Medicare because you'll hear people throw out all this terminology: Part A, Part B, Part C, Part D. There are lots of parts, lots of letters. So this graphic is to help kind of simplify what we're talking about. So when we talk about Part A, that is hospital insurance. Part B, we're talking about medical insurance. And so let's say your primary care provider, your specialist. Part D, we're typically referring to prescription drug coverage. And then, so these we would, consider, parts of original Medicare. But Part C is also known as the Medicare Advantage Plan. And so that a lot of people will opt for because it's all one plan. We'll get into that a little bit, but that does typically encompass parts A and B, so hospital and medical insurance, and sometimes Part D with the prescription drug coverage.
Mhm.
Anything you want to add, Fiona, before I?
No,
Nope.
it's
Okay.
fine. Let's go on.
All right.
Mhm.
All right. Okay. So hopefully you can all see this little flow chart. So there are certain changes you can make during open enrollment, as we mentioned. Now, if you have original Medicare, so you are used to carrying your red, white, and blue card, and you have hospital insurance and medical insurance through original Medicare, and then you have a separate prescription drug plan. This is a time of year that you can change your prescription drug plan. And you also, may consider getting a Medigap plan or a Medicare supplement insurance plan. You also, if you have a Medicare Advantage plan, this is a time of year that you can make changes with that as well. So you can compare plans and kind of shop around to see what works best for you. Fiona, anything you want to?
Just to add that when you join a Medicare Advantage plan, you leave original Medicare. You get all your Medicare benefits through the Medicare Advantage plan. And it's important to understand that because, for example, some people say, well, I just like to go see this other doctor that I used to see, or go here or go there. Once you've joined a Medicare Advantage plan, you're committed to getting all your Medicare benefits through that plan. And you have to stay within the doctors, hospitals, clinics, and networks that plan has negotiated.
Yep. Yep.
So it's a different way of getting your Medicare. Yeah.
Yep. And one of the things I know that Fiona, that you do is when you're meeting with clients, you'll ask them, are you okay with sticking with this set list of providers?
Yeah.
Or would you like it to be more portable, where you can kind of go, if you're out of the service area, will you be wanting to see providers out there? So yeah, that's an important variable. So Okay. To enroll in Part D, so the prescription plan, you must have either Part A, Part B, or both. And again, you don't have to memorize this. So just know if it's all becoming alphabet soup, you can always call us. To enroll in a Medicare Advantage plan, you must have Part A and Part B. So hospital and provider. To enroll in Part D or Medicare Advantage plans, you must live in the plan's service area. You may be required to use the plan's provider network. You can't live outside the US, and you must actively enroll and make changes. So Part D doesn't just typically happen for you. It is something that you need to opt into and make a selection and choose which Part D plan that you'd like to be a part of. Okay. Well, people ask, how do I choose a plan? Where do I start? So Medicare.gov has over the years become a much more user-friendly tool for Medicare beneficiaries and their loved ones that are helping them. You can go to the Medicare Plan Finder at www.medicare.gov. And you can actually go in and on that website, you can look up different plans. You can find out what the costs associated with them are. Copays, deductibles, premiums. You can check to see if a particular hospital or clinic or provider accept a particular plan. And one nuance to that is we always encourage people to call their doctor just to be sure. So even if you see it on Medicare.gov, every once in a while something has changed at your doctor's office. So it's important, when you're choosing a plan, to just check in, just be sure, call the doctor's billing office if they have one, or the hospital billing office, and just confirm, hey, I am wanting to switch to this plan. This is the plan number. Will this provider accept this plan? And that way you have the peace of mind of knowing that that your coverage is intact. But there's a lot you can do on the Medicare.gov site, and they also have a lot of really good consumer information. So about what are the different parts of Medicare, how do they work together? So just know that that is a fantastic resource, especially during open enrollment. Fiona, anything you want to add to that?
The first thing you do when you go to Medicare.gov, if you can set up your own account, that's great. Or help someone set up an account. That's very helpful, because the first thing you usually do with this is you go in and you set up a drug list, entering all your drugs or your client's drugs or whoever you're helping, their drugs. And then you create a drug list. And then from there, you go into select plans that have those drugs on their formulary or their list. So it's very helpful to be able to do that. You can save your drug list. You can save the information that you've done if you have your own account. And then you can also give it to SHIBA. We can help you with it. But I would recommend, if it's at all possible, to set up an account on Medicare.gov.
Yep.
Mm-hmm.
Yep. Wise words. And that way you don't have to keep re-entering the
Right.
drug list from year to year. It will save what you've entered. Yeah.
Right.
So yeah, really good advice. And so it's a great way to see, is what you need covered? Will you get the best price using the pharmacy you prefer? That's another feature that's helpful for a lot of people. A lot of times people will choose a specific pharmacy for a specific reason. Maybe they go to a particular, pharmacy down the street from their house because it's the most convenient. But sometimes people find on the plan finder on Medicare.gov that, gosh, mail order pharmacy would actually be easier, or it might be cheaper. Or it might be cheaper if I drive a little bit further down the street and pick up my prescriptions at that other place. So it's a way that you can go in and you can kind of play with different options, and you won't break it. You won't break anything. You won't accidentally buy anything, hopefully, but you can kind of play with it and just compare things and just get a real visual in front of you of what are the different costs associated with different parts of these different Medicare plans. Um, so yeah, so I highly recommend. And it is, like I said, becoming more user friendly all the time. So even if you're not an IT professional, uh, you can go in there and you can find out a lot of information just right there at your fingertips. It's pretty simple to navigate, thankfully, for some of us who aren't, you know, uh, we're not the next Bill Gates. So,
Okay.
all right. Um, so if you're wanting to get more information, or you'd like to, enroll in a plan and you just like to kind of get some advice on that, or make sure that you're not missing anything, or yeah, you just want to talk to someone who is well familiar with how the different plans work. We are here. SHIBA is a resource that's here for you. You can dial the statewide 800 number, which is actually, even though it sounds counterintuitive to call a statewide 800 number, that is actually the fastest way to get connected with a SHIBA volunteer. You can call 1-800-562-6900, and you'll talk to someone initially at the Office of the Insurance Commissioner for the state of Washington. And then they will, gather a little bit of information, and then they will get you connected with a local SHIBA volunteer. And we do let people know that we contact people in within 2 business days, typically. During open enrollment, we do ask for a little bit of grace because we have an influx of interest, and our SHIBA volunteers stay busy counseling a lot of people on their Medicare options, and we also do a lot of presentations. And so if it may take a little longer than 2 business days, we apologize in advance. But we will call you back, and you will have the opportunity to discuss your particular situation with someone who's knowledgeable on our SHIBA team. Um, and then also, if you don't want to work with SHIBA, that's also okay. As a consumer, you're not required to work with us. We're here for you, but our feelings won't be hurt if you decide that you want to call Medicare directly and have them answer your questions. You can dial 1-800-Medicare, and again, navigate the Medicare.gov site, because it's important that you do what works for you. And so they will have their team answer questions from consumers directly. Sometimes you may have a little bit of a hold when you call, but I know that they do boost their staffing for open enrollment. And so hopefully you'll get through to someone knowledgeable and helpful when you call. But that's something that, if you don't need us, that's okay. But we are here if you do. Okay, now we're going to get a little bit into the weeds here, so please bear with me if your eyes are glazing over and you're you've had to get up and stretch. Um, During open enrollment, you'll want to enroll in the new plan you want, and if it's a particular type of plan, it should automatically replace your old plan on January 1st. So that includes if you're switching from a standalone Part D plan, so prescription drug plan, and you're going to a new standalone Part D prescription drug plan, um, your coverage will start January 1st. If you are switching from a standalone Part D plan and you switch to a Medicare Advantage plan, let's say you had, Part A, you had Part B, you had your standalone Part D plan. When you go to Medicare Advantage, that will bump you out of original Medicare, including your former Part D plan. Okay. If you're switching from one Medicare Advantage plan to another, uh, your new plan will automatically replace the old starting January 1st. And if you had Medicare Advantage and you thought, you know what, I'm gonna go back towards original Medicare with my standalone Part D plan. You know, I like that drug coverage better, so I'm going back. Um, that will that change will return you to original Medicare. And if you are listening to this and you're confused between Medicare Advantage and you know, original Medicare, don't panic. Help is available. And so um, it, uh, it can get confusing when you hear Medicare, Medicare Advantage, Medigap, Meta this, Meta that. Just know that help and support are available. Okay, speaking of Medigaps, um, Medigaps are also called Medicare Supplement Insurance, and they are designed to fill in the gap. So you may have, you know, had gap insurance with other types of insurance policies, but these exist to pay what original Medicare doesn't. So original Medicare is intended to pay 80% of costs, and a Medicare or a Medicare supplement or Medigap plan, if you opt into this, if you buy this plan, it will pay the other 20% of your expenses. Um, and there is, you know, a monthly payment that you have to make with this type of insurance. And Medigap companies have to be approved by the state that they are being sold in. So SHIBA volunteers, they keep and have and they stay updated on what Medigap policies are available in the state of Washington. You know, sometimes a Medigap plan will go away and sometimes a new one will be added. So we stay on top of what's available. But it is an expense, you know, a monthly expense that people pay. But a lot of people find it very helpful if their care is going to be very expensive or they have a huge hospital bill, or if they are having a big surgery. So if their expenses are expected to be quite a lot, sometimes a Medigap plan is a really good choice for people. But again, it all depends on your budget, your circumstances, and your needs. And these are optional. So these don't just happen. These are plans that you would need to opt into. Medigap policies are sold by private companies, and they do fill in the gaps in original Medicare. So deductibles, coinsurance, and copayments. The best time to buy Medigap policy is during your 6-month Medigap open enrollment period, which starts when you're first enrolled in Part B. Okay. Fiona, did you have anything you wanted to comment about this? And it's okay if you don't, but yeah.
No, I guess we'll wait and see if this is a concern to people and if there are questions about it.
Okay.
Because Medigaps are, they tend to be more expensive. The monthly premium is a lot higher than a Medicare Advantage plan. And particularly in Clark County is a very heavily oriented Medicare Advantage county, meaning that many of our clinics, doctors prefer to take Medicare Advantage plans rather than original Medicare. And keep in mind with the Medigap, all you've done is you've taken your original Medicare and you've bought some additional insurance to help with the costs. And so you're still in original Medicare. And we do have some issues in Clark County with places not taking original Medicare. So that is something to consider if you can, you know, if you have someone who's coming onto Medicare in Clark County and is considering a Medigap. Now, there's specific reasons why a Medigap might be better, even over a Medicare Advantage plan. And so that's what we're talking about, but we don't need to do it here. We'll see if there are questions and people want to learn more about it. I think that would be the best way.
Sounds good.
Okay.
Sounds good.
All right.
Yep. All right. Okay, and this is a bit more about Medigaps. The best time to enroll is during the first 6 months, starting with the day you turn age 65 or older, and you have parts A and B. During these first 6 months, the plan cannot subject you to a health screening or deny you for pre-existing conditions. So there is a guaranteed issue during the first 6 months. If you miss the window, then your situation's a little bit different. So you can apply for a Medigap, but there may be some nuances around that. So, and the company does not have to sell you a Medigap plan. And it is open throughout the year. So if somebody wants to buy a Medigap plan anytime during the year, that is open to them. Okay. Like I said, there's no yearly open enrollment for Medigap plans because people can purchase them at any time. And if you have questions about Medigap plans, another good resource is the Office of the Insurance Commissioner. And again, you can call the SHIBA helpline at that 1-800-562-6900. But if you have very specific questions about Medigaps, they are also a good resource. Okay, this is my favorite part. Help paying for Medicare. This is what I love the most about being involved with SHIBA, is that we want people to know that they may be eligible for help paying for their Medicare expenses. Okay, so for Part D, prescription coverage, there is a program called Extra Help, and it can help pay for your Part D costs. And I'll defer to Fiona to get into that a little bit if she'd like.
Well, I don't know. Extra Help is Social Security runs it, which is interesting because you have to deal with Social Security if you're applying for Extra Help. And it only is help for Part D, so for prescription drugs. And there are some big changes coming down, which you may have heard about for this next coming year as to the cost of prescription drugs. And but Extra Help is designed for people who are of a certain income level or below to get some lower costs on their co-pays and their deductibles for their drugs. The Medicare Savings Program helps with payment of both your Part B premium and also for some people who qualify for the higher level of the program, you get help with your co-pays and deductibles. And that program, it's actually a federal program, but it is managed entirely by the state. And so you go to the state to apply for that, mainly through Department of Social and Health Services. So you've got two different locations. You go to Social Security for extra help with your drugs, and the state if you want to apply for help with your medical expenses. Okay.
Yep.
Yep.
Yep. And we can help point people in the right direction for each of those programs. Absolutely. Yep. It is just nice to know that they exist. And I'd like to touch on just a little bit, just a kind of a preview or a sneak peek, as it were, of some of the changes that are coming for Part D, just so that you have it on your radar. The Center for Medicare and Medicaid Services, or CMS, is releasing more information as we go. But one of the changes that is happening for people who have Part D prescription coverage is that there will be a maximum out-of-pocket expense of $2,000. So whether you are on the most expensive medication on the planet, or you don't use a whole lot of your Part D coverage to pay for meds, there's a cap that will be starting on Part D plans, $2,000 total out of pocket. Another change that's coming is that people can spread out their payments for their medications. That is a new change that's being rolled out this upcoming year, where at this time, people may approach the pharmacy counter and have to pay out a big chunk of change to get their medications. And for a lot of people, that's a deterrent. They may say, gosh, I don't have that in my budget, that much. So yeah, I'll come back. Some do, some don't. So what it's intended to do is spread out payments for medications over the course of a year, so that it's not out of pocket whenever you go to the pharmacy. And then your insurance company will bill you on a monthly basis. Okay, so that's a new change that's coming that hopefully will help people have that continuity when they're taking their medications. They won't be deterred by something that's unaffordable when they go to the pharmacy. And hopefully it'll make it a little bit easier for people. But the dreaded donut hole that a lot of people talk about and not everybody understands is going away. So there will be just that cap at the $2,000, and people can spread out their payments. So that's kind of the heart of it. But I'd be happy to send more information and some fact sheets to Hope Dementia, so that yeah, anybody here that's interested can read more about it. Okay, so we are looking at numbers that are changing. So this slide gives the income limits for the Medicare Savings Program, but they will change again. So you will be able to see on the Medicare.gov website what the federal limits are. But we also will be seeing on the website of the Office of the Insurance Commissioner, and SHIBA will be publishing and sharing information about what those numbers look like for 2025. Know that if you're looking on a federal website like Medicare.gov, and they give income limits for the Medicare Savings Program and also for extra help, different states have kind of leeway to adjust those income limits. So Washington State is actually more generous in the help that's provided for people through these different programs. So if you go on Medicare.gov and you think, oh shoot, I don't qualify for that, you might, as a Washingtonian, qualify. So so I apologize, we don't have the newest information on these slides, but if you have any questions, we're absolutely here to help. Okay, and again, this is extra help. These are numbers for 2024, which is what we're living in, but they will change a bit going forward into 2025. So I won't belabor that too much. Okay, so with that, we'd be happy to open it for questions. And again, I'm going to toot Fiona's horn. Please feel free to pick Fiona's brain, because again, 20 years of experience, she knows some things. So I'd be happy to take any questions that people may have.
Well, I have some questions for you, and you may find them basic, but it's important. So number one, who is eligible for Medicare?
The majority of people become eligible for Medicare when they turn 65. But there are other groups, people who become disabled, and that disability has been approved as a disability by the Social Security Administration. They can go on Medicare usually about 24 months after they've been approved as having a disability. So that incorporates frankly, now more and more people, we have people therefore quite young going on Medicare if they've become disabled and are not, able to work, then they can go on Medicare. Those are the two main groups. And the 65, though, is the most important criteria in this country for becoming eligible.
So do you automatically become eligible for Medicare, or do you have to sign up for it?
Well, you do become eligible. Now, most people who have had work histories in this country have earned their Part A. And so when they turn 65, they actually do have their Part A, whether or not they apply for Medicare or not. It's given to them because they have earned it, they've paid for it, over the years. You can also get that benefit through a spouse who has worked. Now, your Part B, because and it's free, Part A is free to you because you've paid for it already. Part B, which as you may recall is your medical coverage, you have to pay for it. There's a monthly premium. So what Medicare will normally do is they will send you information saying, if you've applied for it, you usually enroll for Part A and B, and then you have to start paying your monthly premium for your Part B. Most people have that taken out of their Social Security premium, their monthly benefit. Now, it can get more complicated as to what you do with your Medicare if you're still working. And there's actually quite a few things that can happen there. Do you want to get into that, or is that enough information at this point?
Well, because we're asking about enrollment, I think that would be helpful.
Okay. If you are 65 and you are still working and you have employer coverage, and that employer coverage is sufficient or complete enough, you can decide to waive your Medicare at that point. So you don't really have to apply for it. And then when you do get ready to retire, you will need to contact Social Security, and they will ask for information to prove that you've had coverage through your employer all this time and that coverage was sufficient. And you will need to request then permission to enroll in Medicare at that time. So basically, you can waive your Medicare if you've got employer coverage and you're continuing to work. Let's see. Anything else? Does that help?
Is there a late enrollment penalty?
Yes, there is a late enrollment
You don't
penalty.
take it right away because you're still working or whatever?
No, if you are still working, as I mentioned, and you have coverage in some other way, like through your employer, then when you do go to apply for Medicare, as long as you can show Social Security that you had coverage, there will be no penalty. And that includes drug coverage. Okay, because many people still have drug coverage when they're working through their employer. Okay, so if you can show that you've had coverage and you didn't take your Medicare at 65, then you will be okay, no penalty.
And then when does a penalty happen?
Penalties happen if you have put your head in the sand, ignored turning 65, didn't do anything with your Medicare, and just let it slide by. And you're not working, you don't have any other source of coverage, then you will start to accrue penalties.
And what does that look like?
Well, for Part B, which is the one you have to buy, remember Part B you do have to buy.
Right.
If you've gone for 12 months without enrolling in Part B with no other coverage to protect you, you will start to accrue a 10% penalty every 12 months.
Okay.
Which is added on to your Part B premium. The Part D works a little bit differently. That's a monthly penalty for every month that you should have been enrolled in a Part D plan because you had no other sources for drug coverage and you've let it go. You get a 1% penalty for every month that you should have been enrolled, but were not.
So that would end up being 12% a year.
Yeah.
Okay. Can you clarify a Medicare managed care plan? Is that the Advantage plans?
Generally, when people talk about managed care, they're referring to Medicare Advantage plans. Yes. That's correct.
Is Medicare Plus Choice different from that?
No. You know, the Medicare Advantage plans are allowed to give names to their plans. And so what we would need to do is look at what they're saying when they say you've got a plus choice. That to me sounds like it might be more of a PPO. There's a difference in the Medicare Advantage world. You can have a very strict HMO plan, which is like the Kaiser option, where you really can't go out of Kaiser for anything, correct? That's what we call an HMO network. You have to stay within network entirely for your coverage. Then there's another group of plans called PPOs. And with those, you join the plan. You do have in-network providers. They're usually a little cheaper, but the plan will allow you to go out of network for other doctors' second opinions without getting approval. So that's kind of nice. You can go see a doctor in Portland or something. Those plans tend to be a little bit more expensive on a monthly premium, not always. And the cost for going to the out-of-network provider will probably be a little bit higher. So what I would do with your choice plan is take a good look at what they're calling that plan, read up on it, call the plan, get some more information about what they mean by choice.
So we're always hearing about your plan calling up and wanting to do a wellness visit.
Yes.
Is there a penalty for not doing it?
You don't have to do a wellness. Actually, that's a benefit that's included in your original Medicare benefits. Medicare has a whole list of preventative benefits, and they're listed in the Medicare and You book. And what they call the wellness exam is usually the exam that you get when you first go on Medicare. The idea is we actually have traditionally, not so much now since the Affordable Care Act came in, but we had a lot of people that frankly didn't have any coverage until they went on Medicare. So they really hadn't been in constant, conversation with a doctor, seeing a doctor. Wellness check was designed to get people in the door once they went on Medicare to go over their situation with their doctor and get a review of where they stood, their health. So that's
that the same as that person that comes to your house? They call you on the phone and say, I'm Regents and I want to send out a healthcare professional to check you over and make sure you're getting everything you need?
No, I don't think that is the same as the wellness, but you might ask, if the plan is sending someone out, you certainly want to know who and why they are doing that. It's fairly unusual for plans to send someone to your house. Yes.
I'm asking that because I got a call last week. I'm the person for an elderly sister-in-law, and she lives in a family home, and she has Regents, and they called me to say they wanted to do that. And I said, we got it handled. And they said, but it's part of your benefit.
Okay.
It felt a little pushy.
It felt a little pushy. And what I would do in a situation like that is I would probably, after conversing with them, hang up and then call the plan back, call the plan yourself and go over what they were talking about and make sure it is a benefit that's included, and that whoever you were speaking with is a verified member and, employee of that plan. Does that make sense? I
Yeah,
would
it
do
does.
it. Yeah, if it was unexpected that you were getting this, I would call, and if you were interested in having it, I would definitely call the plan back and get some more information.
Okay. Okay.
Okay.
So if you have a complaint, how do you file a complaint with Medicare?
You can either call Medicare directly yourself. And we did have the number up on there, but you can, and it's also on your Medicare and You book. I think it's even on the Medicare card, although I'm not sure. But you can call Medicare and file a complaint directly with them. You can also go through SHIBA, because we can file complaints with the assistance of the insurance commissioner's office, and they will send it directly to Medicare. So there's two things you can do on that.
Okay. If you have a concern about quality of care, can you get a review through Medicare?
Are you talking about quality of care through a hospital, or is it you feel the doctor is not providing?
This is a question that was fed to me, so yes, yes, and yes.
Yes, on both. Again, you can go through Medicare. Medicare has a whole system set up of quality review of hospitals, and they do have a whole process there that you can report through Medicare if there's a problem. Medicare is actually in contract with a couple of organizations throughout the country that provide oversight and quality control to hospitals. Now, if you have a particular concern with a doctor, that may or may not be a Medicare question. Because the doctors individually, are not controlled by Medicare for the quality of their care. It's really more, most of the states have a state board that oversees medical doctors. If you have a concern with your Medicare Advantage plan or your prescription drug plan, that definitely would be a complaint that you would file with Medicare, and you can go through SHIBA as well. If you have a complaint with a Medigap plan, which we discussed briefly, those complaints go to the Office of the Insurance Commissioner here in the state of Washington.
Okay.
And I know that hospitals also have typically a patient advocate that let's say if you have a loved one who's in the hospital and is not receiving the level of care that you believe that they require, you can enlist the help of a patient advocate through the hospital. Who can kind of sometimes get departments talking to each other and kind of facilitate coordinating care in a more effective way. I know that's something that's kind of outside of SHIBA's scope, but a lot of people aren't aware of.
Yeah.
So
Okay.
who to complain to kind of depends on the circumstance, but
yes, that's what I would say.
Yeah.
If you have a complaint and you want to get some more clarification as to which road to take, I think SHIBA would be helpful in that regard. Keep in mind that if you have a Medicare Advantage plan and there's anything that you're complaining about with the MA plan, like their networks or anything like that, the drug list, you go through the plan first and see if they can resolve it before you go to Medicare. Medicare usually wants to see that you have talked to the plan, you've asked them for help, and they've given you some kind of answer. And then if you're not satisfied with the answer, or if they don't give you an answer and you feel that's not as satisfactory, then you can go to Medicare.
Okay, that makes sense. One of our folks says that we were talking about the wellness visit. she says that Aetna has that benefit as well, that she declined it for years, but this year she agreed and it was a good experience. So a
Well, good
comment.
to hear. Yeah, never hurts to get a little extra care, right? Okay.
Yeah.
Yep.
Yeah.
All right.
And if you know, if there are complaints or concerns about, let's say, if you have someone that you're caring for that you know, is in skilled nursing, in a skilled nursing facility, or an adult care home, you know, or you know, resident in kind of long-term care, the Ombuds program is a wonderful resource. They will advocate with people who are residents in different types of facilities. So let's say if someone's getting subpar care, or they have concerns about the staff, they have eyes on, you know, in different settings. They can go in unannounced into different care facilities 24 hours a day, 7 days a week, and they can advocate for you or your loved one if you have questions about the quality of care. And so our Ombuds program is actually hosted or here housed at Area Agency on Aging. So I'd be happy to share some information with Lynn, and she can distribute that as well. If you aren't familiar with the Ombuds program, they are a wonderful resource, and they are also skilled, trained volunteers, certified, background checked, very knowledgeable. And they do it because they have a heart to make sure that people have a voice, that people who may you know, be vulnerable in a care setting have somebody looking out for them. And so I'd be happy to share resources to be distributed after as well.
That actually is so we, as Hope, as an organization, we have a couple of folks that we refer to most frequently. And number one, of course, is the Area Agency on Aging and Disabilities. And number two is CDM Caregiving Services, specifically for the Adult Day Center. And number three is the Ombudsman Program.
Uh-huh.
So, and something to know about that program is, although they don't have enough volunteers to cover every, for example, adult family home in the county, if you call and indicate a concern, I won't say make a complaint, but indicate a concern, they will be there. And I've had that experience multiple times. So yes, indeed, that's a very good program.
Agreed.
Couple more things. These are things that you, okay, what if you screw up and you choose a Medicare Advantage plan that doesn't include your healthcare providers? I'll give you the couple of others. You didn't really understand what your out-of-pocket costs were going to be. You waited too long to buy Medigap coverage, or you didn't check the prescription list in the Part D. This sounds like it's from people who did those things.
So basically regular people, because it happens. It happens.
People.
No shame in that. It happens.
Do they have is there any way to get around it, or do you just have to wait until next time?
Well, we do have another open enrollment or change period for Medicare Advantage plans. It starts January 1st and runs through March, end of March. When if you're in a MA plan, you can switch to another one. So if you catch the fact that, oh, geez, you know, I forgot about that drug, or your doctor suddenly disappeared, and you want to take another try at finding a plan that works for you, you can do it during that time. You can also make changes if you are low income. If you're getting extra help, the program we talked about, you know, the drug coverage help, or you're in the Medicare Savings Program, you're allowed to change plans every month. So low income, you can make changes more often. If you made a mistake and you catch it after open enrollment, you can maybe rectify it between January and March.
So you just taught me something I didn't know. I didn't know there was a second enrollment program.
Yeah, but it's only for Medicare Advantage. So if you're in Medicare Advantage, switch over. Yeah. If you've gone something like you've dropped and gone back to original Medicare, no. But yeah. And you can also, but those are the most common, and I would say probably that would be the best time is if you've made a mistake and you caught it, would be to look at options during January, February, March.
Okay. And then a couple of questions. You hear about things that Medicare doesn't cover. You
Yes.
maybe had experience with things that Medicare doesn't cover. So
Yes.
here is a list. Eye exams for prescription glasses and the glasses.
Well,
that-
well, a lot of the Medicare Advantage plans do cover eye eyeglass, like an exam, and often provide some assistance because they'll get a relationship with some kind of store, or place where they will allow you to go and get glasses cheaper. That is mostly something the plans have decided to do. Now, there are a few conditions where Medicare does kick in, a few eye conditions, glaucoma and things like that, where Medicare does help out. But for the most part, standard eye exams and assistance with your glasses would have to be your Medicare Advantage plan. A lot of them do help with that.
Okay. How
All
about
right.
long? Does Medicare have any coverage for long-term care at all?
No, Medicare does not do long-term care.
Cosmetic surgery.
Generally not unless they will pay for some if it's after severe injuries, like in a car accident or something like that. It can't be really called cosmetic. It would have to be
Restorative.
life-sustaining or to restore, functioning, like your mouth or something like your jaw. Yeah, if it's strictly cosmetic, no, Medicare does not cover that.
How about things like massage therapy, chiropractic, acupuncture?
A number of the Medicare Advantage plans now do cover chiropractic and acupuncture is becoming more common. Massages, I would say, generally are not, but the Medicare Advantage plans more and more are offering these little extra benefits. So if that's of interest to you, it's definitely worth looking at the plans and seeing if they offer it.
Okay,
Now,
but
Medicare,
straight Medicare, no.
no on straight Medicare. Oh, except for one thing, there's one thing that Medicare does cover. It's called subluxation of the spine under chiropractic, and they will cover that.
Okay.
Don't ask me why, but anyway, yeah. Okay.
Because it hurts.
Yeah, I guess it does.
Thank God for my company. Yes.
Why they cover that one thing, I don't, but that's it. Yeah, subluxation of the spine. Yeah.
And then routine physical exams.
Yes, Medicare does cover an annual routine physical exam.
Okay. And then hearing aids and the exams that are required to fit them.
Again, Medicare itself does not help with that, but many of the plans do offer screenings and some do help, particularly some of our D-SNPs will help with the hearing aids. But yeah, if you're going to get any help with that, it would again be through the Medicare Advantage plan.
My political statement is, isn't that crazy considering what the quality of life is if you can't hear? So if
Yes.
you can't see.
Yes. Yes. Well, I agree with you totally. Just keep in mind when Medicare was put into place, well, to be honest, people weren't living as long, you know, and they didn't cover a lot of things that we're now starting to see people getting and suffering. Medicare also really doesn't cover dental coverage, and that's become a big issue for a lot of us aging Medicare enrollees.
Yeah, yeah.
Yeah.
Well, that is my huge list of questions.
That's a great list. Yeah, that is a great list. Yep.
So, unless anyone else has questions, all of you folks in the audience here, this is your opportunity.
Mhm.
I don't know anybody that has more knowledge than these ladies. So if it's okay with you, I would really like to be able to send out your slides. And we record all of our presentations and then we put them on our YouTube channel.
Okay.
With your permission, so that people can go back and look at it as often as they would like.
Okay.
I
And
would
then
have no objections to that.
Yeah, that's fine.
should have asked you before. And then the other thing is that for the month of October, we will be having Dr. Randy Wolcher, who is the neuropathologist for OHSU, and he's the one who does the brain autopsies.
Oh,
And people who have dementia have the ability to donate their brain. And then it's totally for research. And he's discovered some amazing things. And he gives amazing presentations. He very generously has done this for us. I believe this is the 6th year. And
mm.
you would, oh, well, you're hearing the same thing every year. And you totally are not. So I highly recommend that everybody attend that. And then since I have all these people captive, I just wanted to mention that we have a movie that we are screening tomorrow night at 6, and then again Saturday at 1 o'clock. And it is called Keys, Bags, Names, Words. And the tagline is Hope in Aging and Dementia. So it is a documentary that talks about people with dementia and the way that they are impacted by social interaction. And it's kind of amazing. And then we also have a panel that talks, number one, about prevention, number two, about the magic of music, and number three, about the value of social interaction.
Mhm.
So we'd love to have people attend. It's at the Kiggins. And we're providing the pizza. You can buy your tickets, but we'll provide pizza. And if you've never been to the Kiggins, they let you eat your pizza in the theater. So
Nice.
Fiona and Pam, thank you so much. You answered questions for me, and I'm sure you did for other people as well. And I have one more. This was great. I had no idea about SHIBA. Lots of good information and resources for myself and the folks I know.
Oh, wonderful. Well,
Yeah.
thank you for taking the time to be here. I know both of my parents had dementia, and I know that, you know, collaborating with family members and trying to cobble together resources and, you know, just the day to day, it can be a lot. And so I really appreciate everyone taking the time to spend with us tonight. And so I appreciate you and thank you for all the ways that you provide care and support for each other as you're kind of walking this road. So much respect coming your way as well. So thank you.
Mhm,
But
mhm.
all right. Long day for you guys, I know. So thank you very much for being here.
Yes, well, thank you.
Thank you for having us. It's an honor
Yeah.
to join you. Thank you.
Uh-huh.
All
Take
right.
care.
Bye,
All
everyone.
right. Bye-bye.
Bye-bye.